Bonnie, whenever you're ready, you can take it away.
Hey, well, good afternoon, everyone, and welcome to our webinar titled Managing Outbreaks, Telehealth Strategies for School Health or for Health Centers and Schools. We're really excited for today's content, and we have two wonderful speakers that are joining us today as we expand on our webinars and resources on using telehealth for emergency preparedness. We have selected some questions from the registration. Today, our presenters will be focusing on questions specific to managing outbreaks using telehealth in health centers and schools. And with that, I'll introduce myself. My name is Gone Joe, Senior Program Manager with the School-Based Health Alliance, and I'll pass it over to my colleague, Donnie.
Thanks so much, Gone. Hi, everyone. I'm really excited that you're here today. Just before we get started, I want to say my name's Associate for the School-Based Health Alliance. Many of you here are probably already familiar with our work, but if you're not, I just wanted to provide a quick overview of who we are and what we do. So we are a national organization that works to support and advance school-based healthcare. So we do this through our policy work. We offer standards to the field. We do data collection, and we provide training, technical assistance, and consultation to support school-based health centers from the inception and planning stage all the way through expansion and improvement. Essentially, we support the improvement of students' health via school-based healthcare by supporting and creating a community and school-based or in school partnerships. So before I move on to our learning objectives, I just have a few housekeeping and reminders I want to give. You can hear us, but we cannot hear you. You can use the Q&A icon at the bottom of your screen to ask any questions you might have. We'll have a dedicated portion at the end of the session for Q&A. However, you also, I believe, can type in the chat if you have any questions come up. Both Gona and I from the School-Based Health Alliance and our presenters, Kathy and Brian, will be monitoring that and looking through. We'll make sure your questions get answered. If you wish to have closed captioning turned on, there should be a button at the bottom of your screen that either says CC or closed captions, depending on which version of Zoom that you're using. Additionally, we'll have an evaluation poll at the end of this presentation, and I really ask strongly if you all could participate and complete that, because it not only helps us deliver better content to all of you, but it helps us capture the voices from those in the field. Finally, the recording, the slides, and the resources will all be shared both through email, and we will have a section on our website dedicated to them. So now moving on to our learning objectives. We hope at the end of this presentation that you all as participants will be able to identify effective telehealth strategies for screening, virtual consultations, and remote care coordination to manage infectious disease outbreaks, explain best practices for maintaining continuity of care and managing quarantine protocols through telehealth solutions during infectious disease outbreaks, and understand how telehealth can enhance real-time communication between health centers and schools. And now I would like to pass it off to our stupendous speakers. If you were able to join us for our Crisis Ready webinar last month, you're already familiar with their work and expertise, but if not, you're all in for a real treat today. So with that, Kathy, Brian, I'll pass it to you to give a little bit of background about yourselves and introduce yourselves.
Great. Thank you, Donnie. I'm Kathy Wibberly. I'm director of the Mid-Atlantic Telehealth Resource Center. I am one of the 12 regional and 2 national HRSA-funded, so federally funded resource centers. Our whole mission is to provide technical assistance and training in how to best use telehealth to bring better access to quality care. We tend to focus more on underserved populations, but we work with anyone and everyone. The majority of our services are free of charge. And so I have been doing this for 12 years, and I'm also in the School of Public Health at University of Virginia. And so today's topic is definitely near and dear to my heart. And Brian?
Thanks, Kathy. My name is Brian Gannell. I've been with the University of Virginia Office of Telemedicine for the last 15 years. I'm one of the senior engineers for the office, and I help support the infrastructure that we utilize to provide our telehealth services to the community around us. A lot of my focus over the past few years has been on isolation communication through Ebola and COVID outbreaks, and then using these systems to provide sort of event support and different things out in the field. So look forward to talking to you guys today. Thank you.
All right, so this topic is on managing outbreaks. And so we're going to look at telehealth strategies. And next slide. So I don't think I need to emphasize this, but over the last year, a lot of these things have been in the news, and they've been in the news more and more frequently for a variety of reasons. One is the growth in international travel and international people in the United States. So a lot of things that were not seen in the US are now being brought by travelers. So that's one thing. Another is climate change, which is fostering a lot of the diseases and giving it an environment that it did not have before. But the third and probably most salient one for us is the decrease in immunizations over the last 10 years. It started about a decade ago when people started feeling less and less confident in immunizations, and then COVID kind of ramped that up even more. And so there's a lot of immunization kind of skepticism that has come from that. And so the rates of immunization in most of our schools have dropped quite significantly. And many schools, individual schools, have dropped below the threshold where immunizations are supposed to be really effective. So I think we're going to be seeing more and more of this in the news in these upcoming years. So next slide. These are just things that I picked up just in the past month. So we're looking at whooping cough outbreaks. We're looking at Marburg virus. We're looking at polio outbreaks. That's internationally, thankfully, and not here in the US yet. But I think it's just a matter of time. Chickenpox, as you're all familiar with, bird flu is now kind of starting to grow in the West Coast. And then obviously this is flu season, so we're going to be seeing a lot of that. And so just to set the context for these diseases, CDC tracks these diseases. So there's a huge list of what's reportable diseases. They also offer guidance. Then state health departments and local health departments take that guidance and issue what are either state regulations or state laws regarding what's reportable, and also guidance regarding what you can or should do in terms of returning people back to school when they have been exposed or when they're sick. And so we're going to be talking first about kind of some of the more rare diseases or even more serious diseases. But then second part of this presentation, we'll look at the more common ones and things that we can do. So I'm going to pass the baton off to Brian.
Thank you so much, Kathy. Go ahead, next slide. All right. I think the crucial part of any of these responses is the pre-planning effort that takes place prior to having an outbreak. And I think one of the things we've learned over the past few years is really how our response to some of this stuff happened is it began with the more complex disorders like Ebola, Marburg, and the more complex disorders that require a high level of isolation. And then fast forward a couple of years and we were using these same technologies to manage patient populations with COVID, and we're doing the same thing now with flu and other outbreaks. So trying to use these strategies, these telehealth strategies that we've planned for to do telehealth encounters, to then advance them and use them to control infections and things in our community. It's crucial to develop this strategy beforehand. If you waited till the actual outbreak, it's going to be hard to try to use this technology to get in front of it. But putting together that plan for your telehealth within your school district is of crucial importance prior to the outbreak. And then it'll be a lot easier to try to grow and use these technologies if you're going to manage one of these types of conditions within your community. Of crucial importance for all of this is looking at how you're going to use the technology within your organization. If you're going to be trying to reach out to students, parents, the guardians, and what that looks like. So making sure you have a well thought out and planned process to engage those populations. But further making sure you have a solid plan in place that helps you identify your community partners and how you're going to be communicating with them during one of these outbreaks if it's in your community. Next slide. So as we said, we're going to start off talking about sort of special pathogen and serious infection disease response. And one of the crucial things here, I think, when you're trying to get ready for this is identifying your public health partners that you'll be working with during that. Because a lot of times they're going to have information they provide to you, their requirements within your state, so that you can be prepared for what's going to happen and how to report and work with these organizations when the time comes. Developing a plan of managing these patients. One of the things that we learned with Ebola, typically if they present out in the communities, These require a high level of isolation, and you don't necessarily want to just get them to sort of respond and come to the hospital. So developing a plan to isolate that patient where they are, and then having a controlled transfer to the triage center, wherever that is. And then planning for and testing with your community partners to be ready for this when it happens is of crucial importance for this. If you don't have that framework in place and you have a patient presenting, more than likely you're not going to have these technologies in place to help manage that patient. So that pre-planning and testing with those partners on a regular basis to make sure that you don't lose the ability to do it or people forget how to use those systems is of crucial importance.
One thing I would jump in with is that I included tuberculosis as one of the serious infectious diseases, not because of its super infectious nature, because you pretty much have to have a long exposure to actually catch it, but because of its serious nature, if it's not treated appropriately, a person can die, has a very high probability of dying from it. And part of that treatment is being able to monitor and make sure that the medication is taken and over a long-term process, taken correctly and regularly on schedule. And so that is one part where telehealth can play a role.
And for us at the University of Virginia Health System as well, we did actually include the TB patients to be sort of in the special pathogen realm and not just the regular infections. And that was the kind of nature of the long-term exposure and the need to control the PPE and everything as the people went in and outside of the patient spaces. So for us, we did sort of include that in that sort of higher level. It wasn't the same level of Ebola, because if you have Ebola patients coming in, potentially 2 to 3 patients could shut down the entire facility. And, TB is a little bit different, but yeah, it's still kind of, we do consider that sort of that next level of infection. All right, go ahead to the next slide. So some of the things that we utilize telehealth for during these encounters is sort of filling the healthcare gaps. So being able to reach into the space and diagnose and manage their conditions. You can't always have everybody going into the spaces, but you can have people monitoring the telehealth encounters. So you may have a nurse in the space working with the patient and then have other specialists that are watching those encounters. You can utilize this technology to reach large patient populations to more effectively communicate about what's happening within the community, and then potentially the education around vaccinations and things that need to happen. Contact tracing, so using telehealth services potentially when someone does have an exposure, utilizing these technology for contact tracing. And then the big thing we'll talk about today is really the isolation management with the telehealth. So really reducing exposure, decreasing PPE usage, which is a real cost savings, not only in time, but as far as like money, as far as the supplies and everything, but it improves safety around these patients. One of the things that we really found when we started to stand up telehealth services, if you had people in those negative flow spaces, you could have safety people watching and what was happening and monitoring those spaces. So we found that to be a tremendous usage of these services. All right, go ahead to the next slide. So we're going to go through and we're going to show a quick video. It's 60 seconds, and it's going to actually be a real world example of how we actually intook one of our first Ebola patients. And then I'll talk through sort of how we utilize these systems and how it sort of correlates to how you guys would use some of these as well. So you can go ahead and start the video.
Kosi and Kyle, I don't know if you can see, but they're here.
Yeah, Beth, I got it. We're trying. We had one of our team members' garb split, so we're trying to get them into new garb right now. Like we ripped clothing, so we have an unprotected provider right now. So we're trying to mobilize on that right now.
Kyle, aren't they supposed to have the Seavicide pads for the stretcher to unload into?
They are. Can we get a radio feed to Jonathan and remind him of that?
So, Tom. Tom.
Yeah, go ahead. Go ahead.
They're supposed to have the Seavicide pads down to unload that stretcher on to keep those wheels cleaned off. Tell them to hold on a second. Get the pads down.
Yes. How are you doing, sir? I'm Dr. Sifri. I'm one of the other physicians here at UVA that's going to help take care of you. How are you feeling right now?
So obviously a lot of things happening in that example. And just to give you guys a little history, what really prompted us at UVA to develop this strategy, and I'll talk through what this is, but Many years ago during the Ebola outbreak, we had a visiting professor come in from Africa, and she was telling us how once people went into isolation in these Ebola treatment centers, basically they never saw a human face again, because typically once you were in that isolation area, the only people you ever saw were the physicians and people coming in that had on PPE. So they would have masks on over their face. And so literally what we started to have this conversation was about, because these are communities that are very attached to their families. They would go into isolation, they would lose complete contact with their families, they wouldn't be talking to the providers face to face. And so we started talking through what it would look like to deploy some super simple technology to provide video in and outside of those isolation centers. And so looking at cheap off-the-shelf technology, we developed a plan to use sort of birdhouse cameras and these cheap mobile DVD video screens that we could deploy inside and outside of that isolation area. And that would provide a place that their families could come up to and actually have a conversation with them while they were in isolation. The providers could come up to it and have a conversation with them before they put on the PPE and sort of introduce themselves and entered the spaces. And so we deployed that in Africa. And this is prior to us having patients that had been identified through travel screenings here within the United States. Fast forward about 3 months, and all of a sudden we started to plan ourselves for how we were going to intake those patients. And we had a lot more technology that we could lay up against it. And so we started deploying systems within our negative flow rooms here at the University of Virginia that would be the triage center where the patients would show up. And so what you were seeing in those videos is basically one of the patients that was coming in from an outside center that had been potentially identified through travel screenings to have Ebola. And that was us figuring out how to unload them and bring them into the hospital and then get them through the hospital to the area up in isolation that they would end up. And so we had cameras set up where they were dropping the patient off at the loading dock. And you heard that they actually did do an intervention. They had forgot to put down some pads to clean the wheels of the gurney off as it came off the ambulance. And so there was a real live intervention there to make a change and stop them to make sure that they inserted that during the process. But this technology really allowed us to have a deep level of hands-on, like what was happening with that patient as they moved through the system. And then the last of it was the actual physician that was introducing himself to the patient before he walked into the space with his PPE on. And so for me as a telemedicine engineer, it was one of those moments where he was introducing himself and he's having a conversation. The funny part of it is his face was cut off, and that's sort of that telehealth piece when you tell people they've got to make sure their face is, positioned on the screen. But for me, the moment where he was introducing himself to that patient in isolation, which the patient was in a tremendous amount of pain and needed a lot of resources, it just really was an eye opener of how these services could be used. The other layers that happened since we had these systems in place were everything from social workers having conversations with the patients while they were in isolation, nutritional services, talking to them about their diet. But really the use cases started to come out through the roof as we started to engage these systems. The initial goal was really around safety and talking to the patient as they went into PPE or went into isolation. But really the use cases just started to fall out all over the place. And that was for all kinds of people to be able to continue care talking to the patient. The other thing that we were able to do utilizing these technologies is people that were coming in with Ebola would not necessarily be treated like regular patients here. So if they had some other condition that were happening because of the level of infection, it may dictate how we could actually work with them. By utilizing telehealth capabilities, it actually let us keep up with the patient and offer a real standard of care even when people couldn't enter the space, because we could bring a specialty provider in to have a consult and they wouldn't necessarily have to go in and see the patient face to face. So again, this is what we would consider a high level of isolation when you're working with these systems. So it's the more advanced infections, and it takes a lot of planning and working with your community of partners to plan for this. How this would impact potentially schools at this point in time, and think about people coming back from after the holiday breaks, they've been traveling, and all of a sudden they present with a high fever potentially in your school. What we're saying is that utilizing these services to isolate that patient and reach out to your community, the CDC or in Virginia, it's the Virginia Health Department that controls these responses, and figuring out who your triage center is and who you're going to be working with. You really have to do a lot of that work in advance to figure out who in your area is going to be the response centers. In the state of Virginia, it's University of Virginia and VCU. So if people come into the state and through the airports and they test positive for a travel screening, they would end up at one of those two centers. And so working with us, as a school-based telehealth program, reaching out and planning to get set up to work with organizations like us during an outbreak. All right, you can go ahead to the next slide. Okay.
Also just add for the piece on TV. So one of the things that you really want to do in terms of your planning is to reach out to your local health department, because they are typically who you would report to. So let's say a child, tests positive for TB and they're symptomatic. They're coughing, they're, showing all sorts of symptoms. You will want to have a conversation with that local health department before this even happens to know and understand whose role it will be. Oftentimes, the health department will say, hey, that child will be able to return back to school fairly quickly, but they're going to have to keep their course of treatment for a fairly long time. And so who is going to do the direct observed therapy? Sometimes it's the health department. Sometimes they'll say, hey, that kid's going to be in school. Maybe they'll go to the school nurse's office and get and have that observation. But having that coordinated in advance is helpful. But then what if it's a school holiday? What if part of their therapy happens when the child is actually not feeling well and they're at home? How are you going to do the direct observed therapy that way? And that's where telehealth can come in to play. And it is actually recommended by CDC and others to use the virtual strategy for direct observed therapy. But then to have that process in place to know, this student is going to be out, or we're having a 2-week break, but we need to have these medications observed for these 2 weeks during that break. How are you going to do that by telehealth and having your staff trained, or having that coordination at the local health department level?
Perfect. So, I guess the next area we'll start to talk about is utilizing these tools for the less severe infections, so flu, COVID, chickenpox, and so how we utilize these same technologies to provide care for those. Some of the use cases would be consultation and follow-up care. So telehealth can connect students with providers from school or home. So whether the student's at home and they're at the nurse's office, if it's another virtual clinic that's potentially set up at the school or their home, you can use these telehealth strategies to communicate and see the student and try to keep them in school or figure out when they're going to be coming back to school. Utilizing these technologies for screening and triage of symptoms. So telehealth allows for the providers to screen for the symptoms remotely, even to the point where you could have people taking an at-home flu test or COVID test and monitoring that through these technologies, and then providing sort of next steps and where they need to go for further testing. This way you can help get students back to school faster at the end of their infection. The other area that we see a lot of telehealth usage during these, and especially for somebody that's out for something like TB or a longer period of time, is potential mental health support. So being able to reach out and have further conversations around that. And that's a pretty standard use for telehealth in these types of circumstances. Go ahead to the next slide. So when you're planning for all this, we do a lot around planning for the use cases and how we're going to use the technology. The other crucial piece of this is determining what your platform is going to be to provide these services. And it could either be an all-in-one service, so it has something that you purchase that provides the video throughput. A lot of organizations use the major platforms out there. So Zoom, WebEx, or Microsoft Teams can all be utilized for these types of strategies. Making the decision on the platform in advance, getting access to the accounts that you need, and having the right business agreement signed so that you're in compliance to utilize these solutions is all crucial to have in place in getting ready for a pandemic response. Setup of devices and testing and how they attach into this. So if you're going to be using iPads or mobile devices, how people get access to the resources. When you're making a choice of one of these platforms, some of these platforms are better at what we call standard base or interop. Zoom and WebEx are very good about basically being able to talk to other systems. And so through standards-based connections, you can use Zoom and WebEx to reach out to other video applications. Teams is a little bit more of a closed loop solution, but it can also reach out and communicate with WebEx. But just having a clear plan in place and a decision made on which technology provider you're going to use. But we find any of these platforms are really capable of providing these services.
And I would say since most schools are deploying either laptops or something that has video capability, if you already have an existing platform, you may want to just think about getting that business associate agreement on that same platform that you're already using for students, so that then you can use it for healthcare purposes and being compliant with HIPAA. And the other part of the whole platform choice is, the easier the better. So things that people are familiar with using is what's going to be useful when an outbreak happens and the child has the laptop at home, and then you can do some monitoring there, or you can do your direct observed therapy there. So, really think through that part.
Yeah, and I think, to that point, I mean, Zoom has been a one that was used heavily within the school districts, and, it's most likely already deployed. The beauty of a lot of these applications is you don't have to go and download software typically if you're going to try to connect back into a video. So you can literally send a link out and you wouldn't necessarily have to have the application installed. But we'll talk through a little bit more about sort of hardware decisions. But I think one of the points that I didn't mention, but I've talked a lot about in some of the other areas, is understanding what your community partners are going to be using during these types of events. And so if you're going to be working with the CDC or your department of your state health department, like what are the platforms they're going to be using, and making sure that whatever you have is compatible with that. And it may be different than what you're using for your student telehealth portion of it. You may have Zoom that you're using to reach out to your community partners, because that's what those people are using to set up that community connection to be able to communicate. But you may have a different platform that's your telehealth platform you're using with the students, but it could be the same. But I think to Kathy's point, if it's something that you're already using within your organization, to utilize that because of people are familiar with that application, it makes a tremendous difference in the ability and the tech support needed to provide, to use that service. Okay, go ahead to the next slide. So one of the things in planning is you've really, as we just mentioned, is like planning for that technology. And I think, for me, if you have students, most students today have laptops that go home with them, and most laptops today have microphones and cameras built in. So you don't have to reinvent the wheel if you're trying to do telehealth with your students. A lot of times it's a challenge when you're trying to do telehealth services because you don't have the technology out there. And so with this, a lot of times in school-based, you're going to have some framework of technology already out in play. If you're trying to do further diagnosis, and that's one of the things I'm trying to show on the slide, it could be as simple as a laptop or a tablet. It could be more advanced, like the cart that's on the just below that. The carts would typically be something that would be set up in a nurse's office or a clinic, and that's something where they could interact with the patient on a different level, but that's not typically something you're going to have at your home. At the home side of this, more than likely, unless it's somebody that's been pre-identified with a condition, they're just going to have a laptop and a webcam and microphone. If it's a person that has been identified with a chronic disorder, you may redeploy equipment that you could reach out in a different way. And some of the things I'm showing on the right-hand side are stethoscopes and otoscopes that can be activated remotely. So you can provide a remote exam with those patients. You can monitor temperature, and then you can see into and provide an exam with those patients. But the challenge with that is you have to have that technology out and in place prior to the pandemic. And typically, because of the expense and everything associated with those are going to be folks that are already identified as with chronic conditions. And so you already have a framework to reach out to them. But identifying all this technology ahead of time is crucial, as I keep saying on every slide. And then some of the technology that we deploy is not going to be super sophisticated. It could be as simple as a digital thermometer there on the right-hand side. And I'll talk through in a few minutes, like how you might use some of those in some of these responses. So go ahead to the next slide. So talking through all this, and just a few things to keep in mind is about device management. So again, what devices are you going to use? What are you going to send out to the patients or the students? Who's going to manage those devices? If you have this as part of your school telehealth program and it's part of your school technology, you already have a framework for managing those devices. But if not, there is a real challenge for how you handle and work with those. So if you have a tablet that you're going to send out to a patient, if it goes out to one person and they use it, if it comes back, you have to think through things like how do you clean that equipment and get it set up to go back out, and who's managing that. And most of those processes are pretty time consuming. For us as a big institution, we typically lean into partners that help us handle the device management portion of it. So they have expertise in sort of sending out those devices to the patients, retrieving those devices from the patients and then making sure that they're sterilized in between those two. A lot of times those companies also offer technical support beyond. So if there's devices that are associated with it, and that's of crucial importance too. So if you have a home monitoring device that goes out to a patient, like who's going to be there to help them with that device? And so if you're using like a secondary company that's helping you manage your infrastructure or your technology, they could be the ones that provide that technical support. But if you don't have those, you do have to have an idea of if they're having trouble with this technology during a consult, who do they reach out to get help with it? So device management and planning is, again, crucial during this process. Next slide. So we're talking about a couple of different things here and how we use the technology. And one is like school-based telehealth versus home telehealth. And so will the patient be at school or at home during the consult? And sort of a further question, well, home-based consults can utilize your school-provided laptops and other devices to mitigate the need for special devices. So the school-based side of it's interesting because they may be in the nurse's office, so they may actually be reporting down to the nurse's office, or there may be a special clinic that's set up that is set up specifically to provide virtual care. A lot of times these spaces may be different than the nurse's office because the nurse is helping manage your patients within the school. You may have a separate telehealth area set up that's more for that primary care type visits so that you don't tie up the nurse's office when the folks are trying to have these further visits through telehealth. So identifying those spaces and making sure they're prepared for the students, and then how you're going to use these technologies during these sort of programs. So go ahead to the next slide. So what we'll do from here is we'll start talking through some of the real world use cases for these technologies and how we're deploying them in the schools. And so the next slide, we'll start to talk through just some of the current deployments and how schools are using telehealth to control and mitigate infection diseases out in the real world. Okay, so the top left basically is a picture of a student that's doing a telehealth encounter. You can see there in their hand, they actually have a digital thermometer that they're using during that program. And so one of the things that I just really want to make sure I focus on is how we're using telehealth to provide care to patients during these times. If it's following up for infection control, it may be monitoring temperatures. So at UVA Health, when we had during the COVID outbreak, when we had patients that would go into isolations, one of the big things that we monitored then, and you guys can all remember, is everywhere you went at that point in time, we were monitoring temperature. If you're trying to follow a patient's temperature over telehealth, I mean, if you're talking remote patient monitoring, it takes a fair bit of work and planning to have that stuff set up. And for the majority of your patient populations, you're probably not going to have some digital thermometer that is Bluetooth enabled set up for all of your students. So one of the things that we identified early on in the process is using some pretty low tech solutions along with telehealth. So if you have a video consult happening, literally having the patient take their temperature with the digital thermometer within that video image, and you can monitor the temperature reading yourself. And so it's not self-reported at that point in time. You're actually recording it from the device. And that was one of the challenges we had, is to try to make sure people were honest about what they're reporting. And so by engaging a video call, you can actually monitor the temperature readings live on the fly. Something you guys have probably heard in the news the last few days, or excuse me, the last couple of weeks, is they've added to a singular test now. You can do COVID-19 and flu testing in one test. I think it moves from, I think for COVID, it was around 15 minutes. And I think this combined test is like a 30-minute test. And so one of the things we've proposed is if you have a real need, so when we first started doing COVID response, and a lot of folks, if you have children in school, you can remember this, if you had your child presented with COVID, you had to get a test, and at first you had to have a test from an official place that had to say that they were tested positive or negative. And to get back to school, you had to get the negative test, and it had to come from somewhere. Eventually, this became where you could go get a home test, and you could just self-report and say, my child is negative. The challenge is that we have found that a lot of parents during these outbreaks become more, or I won't say it's more important that they go to work, but the reality of it is that we're dealing with a lot of different things, and you want your child to be in school, and they don't necessarily always pick up the test. And so one of the uses for telehealth during these cases is to actually have this test take place with the video camera on, and you can monitor the actual usage of the test, and then you can follow all the way through and watch the results at the end and see it, so that you have a very valid test to make sure that people are testing before they bring the student back. But utilizing these technologies, you can really identify patients that have gotten to the end of their infection and get them back to school quickly and not have them waiting for additional testing out in the field. So really engaging these telehealth strategies to follow your patient population and monitor them during their sickness, and then identify when they're healthy and get them back to school quickly. And so that's really how we look at using these systems. We've talked a lot about the sort of further, like people who have chronic diseases within your community. So if you do have patients or students that have been identified that have a lot of chronic disorders, you could pre-deploy things with them to follow them during these cases. And so that's sort of that bottom left example, and that's some blood pressure cuffs and different things. If you've got students that are diabetic and stuff like that, you can do some home monitoring type solutions for those. But again, those have to be out before this starts happening, because it's very difficult to get those technologies out during a pandemic. So,
and I'll add to what Brian was saying. We have definitely heard stories from schools, and you probably know of parents who've done this. They give their kid a dose of Tylenol before taking their temperature an hour later. And so their temperature's no longer there. Well, we can send this kid to school. He's healthy. So I think being able to do some of this monitoring in real time, possibly at random times of the day so that they don't know when it's coming up, will help with some of those families where you suspect they're just sending their kids to school sick. But I think also in the case of like measles, the guidance typically is, if a child has measles, they're home until their rash is gone, or, it's 4 to 5 days. But for those who've been exposed to that child, so let's say this child is on a sports team and now everyone on their sports team has been exposed, and maybe 3 of those kids were not immunized. The guidance is actually that they need to stay home for 21 days, and you need to monitor symptoms for 21 days before they return to school. So this is, another area where you can do a video conference monitoring. Do you have any rashes? Can you show me what that looks like? Do you have pink eye? Because that is one of the symptoms that accompanies measles, and be able to, take a look at their eyes. And so being able to do that on a regular basis over those 21 days can also help that child return to school, or get help if they actually have symptoms of measles.
perfect. All right, go to the next slide. Okay, so this is a couple of real world examples of some of the communications going out. So the example on the left, caring for your child's health just got easier. And so this is communications going out to the school district, basically to sign up for telehealth services prior to the pandemic. And I think having these in place and getting people signed up and ready to go, so really getting the information out that you have this program available will help you greatly respond to the pandemic, because then you have the resources in place and ready to use with your students. But just some of the ways that they use to follow this. So very basic technology. Let's see. So again, this basically shows no insurance needed. See the doctor anytime. And so they have a program set up that they have the physicians ready. And so this is not just a school time initiative. So I think to what Kathy was saying, you may have a student after hours that presents, and they can utilize this service to basically figure out if they can go back to school the next day. So if they presented at night, you can actually utilize this and keep your student in school as much as possible. Canyon's pilot testing school-based telehealth at 17 schools. And I think we're really just seeing that more and more school districts are getting set up to do this. A lot of the conversations I'm having around sort of primary care at the school, parents are busy. One of the questions that comes up a lot is around consent. And so having the consent in place prior to, and so parents have the opportunity to sign off on this consent prior to needing the services. And this way, it's not sort of an urgent thrash to get that information out to them. They've had time to look at it and sort of prepare for it. And so by having that telehealth program in place prior to an outbreak and having those consents in place really help ease the pain of it during a pandemic. The bottom right, I have some information, telehealth blueprint in schools, and that's a Broadband Ohio initiative. I found that to be a tremendous resource for putting together using telehealth in schools and setting up the very basic kind of framework for how you use these solutions. So I think these are great resources to sort of plan and get things in place prior to the pandemic, so that you have a telehealth solution ready to go and to use and respond to during an actual outbreak. And so go ahead to the next slide. So the other area that we utilize a lot, so we've talked through sort of using telehealth to respond to infection control. We utilize it for educational services. So during a pandemic, you could be using these to provide classes around some of the vaccination requirements or some of the things that are out there. So providing a framework for your student populations and parents to gather information, and you can utilize these telehealth strategies to disseminate that information. But the other way that we use a lot of telehealth during pandemics, and this is both for the long-term infections and for folks that are, 21 days with TB, is utilizing these services for a lot of the mental health support beyond. Folks that go into isolation typically need a lot of resources. Why me? Am I isolated for 21 days with something or longer, depending on what the infection is? And so being able to use these services to triage and reach in and maintain that continuity of care with these patients and sort of maintain their well-being. And I think that's a very powerful use of telemedicine in these circumstances, to be able just to continue the support of your patients. One of the things I spoke through was when we used it for Ebola response is, providing things like social services and like nutritional services, but these little pieces really help people feel whole during these types of events. So really trying to keep that sense of normality, utilizing telehealth with people and, access to as many things as they can get. So.
And I would add that, when you have kids in isolation, it's particularly important for middle school and high schoolers where social connection is so important. That to be able to, if they're being isolated, and again, I can't stress enough that, with the immunization rates going down, you're going to have more and more instances where there's an exposure to something like measles, and they're, a subset of your school population is going to be home for, 2 to 3 weeks, and to have them isolated, is going to have a toll on their mental health. And so to be able to offer services, even if it's just, hey, let's just get together as a group virtually and have a conversation on how you're feeling today, how you're doing today, will help create some of those connections.
Yeah, and that's a great point, Kathy, because I think that one, after COVID, that was one of the things, our kids have been in a new paradigm ever since then. It really impacted them in a bigger way than it did the rest of us in some ways, because of it really changed their school exposure and what they get access to. So I think using these resources to really help, solidify the mental health piece is a crucial piece. Yeah. All right.
So, I've said it a couple of times now, we're going to be seeing more and more of this, and they're small things like outbreaks, but we are going to have another pandemic. And it's not a matter of, if, but it is a matter of when. That is how our environment is happening. And so we had lots of lessons learned during COVID. And, we all hope that it doesn't happen again. But we can't count on hope, and I think we should be really, really, I think it would be on us if we were not prepared for the next pandemic, because we've already experienced one. We know what it's like and we can prepare. And so if we take those lessons learned and start thinking, take that time, it could just be a couple of hours where you sit down with your team and go, okay, if we were to have another thing like COVID again hit our schools, what would we do differently? How can we prepare for it? And write some of those plans down, because as turnover happens, people forget. People forget what happened during COVID. People forget those lessons learned. And if you don't write them down, you maybe in 5 years or 8 years, when you have a lot of staff turnover, people are going like, I can't remember what we did then and what we learned, and we're starting from scratch. And we don't need to do that. We can really look back now, while it's still relatively fresh, and get some of those things down on paper. This is what we would do differently. This is how we should handle it next time around. So next slide. And I said this at our last presentation, but when disaster strikes, the time to prepare has passed. And so when that next outbreak strikes and you're not prepared, that's not the time to be thinking about preparedness. And so really think now, think in advance. Take your time either over the break, maybe, or even during your summer break, or take a time during a staff retreat and really think through what we're going to do. Have those contacts with your local health department. Have them on speed dial, know who to talk to, and coordinate those things. If this were to happen in our school, what is our responsibility? What is your responsibility? How do we do this? How do we communicate with you virtually? How do we, manage a patient or a student who needs to be isolated or even quarantined for a period of time? Where can we put that student if they show up in the nurse's office and now, we have an infectious disease going, where can we put this student while we wait for further guidance? I mean, those are all things that you need to think through before it happens.
Great point, Kathy.
So next slide is just our contact information, and we are happy to, take questions now, but we're also happy for you all to, if you forget you had a question and you want to shoot us an email, where, we are happy to respond to you as well in that way.
Thank you, Kathy. Thank you, Brian, for another really great webinar. So much great information was shared today. I was taking notes and I just wanted to share some of my takeaways with everyone. So loved, hearing the examples of the lessons we learned from managing serious infectious diseases, and, learning that, sometimes when patients are experiencing those serious infectious diseases, they're not able to see the faces of their care team members because they're in full PPE. And telehealth really is a great opportunity to reduce that fear for patients. It gives them that sense of normalcy back, and it allows that student or that patient to see your face when you're taking care of them. So especially in school-based health centers, when the goal is for that student to feel comfortable with the providers and the school-based health center staff that is taking care of them. Another takeaway, that telehealth and video technologies allows us to do that care coordination for the student or patient to bring together that interdisciplinary team. So who is on your team? The health department, the school nurse, school staff, your community providers. So bringing them all together using the technologies that you have. And then lastly, I love that reminder, Kathy, that it's so important to think about emergency preparedness before it happens, because it's not a matter of when, or it's not a matter of if, rather it's a matter of when is it going to happen. So thank you so much for that great content. If you have any questions, feel free to put those in the chat or in the Q&A. As we're waiting for questions, we have a few. So for Kathy or Brian, what are some effective ways to prepare students, parents, and guardians for the use of telehealth in outbreak situations?
Yeah, I always say, the time to learn how to use telehealth is not during an emergency. And so some really, fun ideas would be, next time you have a back to school night, just set up a little telehealth practice station, just, in the entranceway or wherever you have kind of other resources displayed. And, a parent can just come up and just like do a test run of a consult with a telehealth provider. You can do it, provide guidance to them in your back to school packets, whether that's virtually or online resources, or things that you send home with kids, or things that you send home at the beginning of school. Those are all good ways to do that. And it's similar with consent forms. If you can build that telehealth consent in with all your other back to school consents that they're signing, it's a great way to do that. And then you can just manage who has and who hasn't signed that consent already. And it would just be for that school year. And then they can update it each year. So those are all ways that you can engage parents before something happens and they have to use it and they're scrambling to figure out how.
Yeah, and I think that's, awesome response, Kathy. I mean, if you're trying to get people onboarded after the infection, you're going to have a lot of challenges. I think, one of the points I was trying to speak to is that it's important, I think, to try to develop this telehealth strategy in advance. It's even one up if you actually are utilizing these services with your patients for other needs and not just during the pandemic. So when it's time to pivot to the pandemic, hopefully they've already been using this technology and it's something that they're accustomed to, so you're not retraining on it. But really if you do have a plan to use it, if you don't have a telehealth strategy that you're using with your patients all along, having documentation that goes out of how you're going to use it during a pandemic, and basically trying to get the consents out prior to the pandemic so that you've got people already in that framework, but really developing that plan and then communicating with your student populations of how you're going to use it during the pandemic. so that people have a plan and they understand that it's going to be used and not something that, because I think during COVID, what was happening a lot is, they would decide to use something and it's like you were sending out sort of documentation on how to use it. But if you already have people using Zoom and you already have a telehealth strategy, just, it's pretty easy to operationalize that, but just getting that information out to the parents in advance. So.
Thank you. Another question that I have is, do you offer trainings for outbreaks specifically for school staff?
We can. I think for me, it would be training related to telehealth, and not specific to the disease state of different outbreaks, but we definitely do that. And the Telehealth Resource Center, if you're not in my footprint, so I'm New Jersey down to North Carolina and across to Kentucky, so kind of mid-Atlantic and slightly west. There is a telehealth resource center that serves you, and you can just go to telehealthresourcecenter.org and reach out to them, and they can do that training as well.
Wonderful. So thinking about schools and how they function, usually that school nurse, if they're present, they're that first line of defense. If a student is sick, they're being sent to the nurse's office. How can health centers or school-based health centers partner with school nurses to tell them about setting up an emergency plan using telehealth to better manage outbreaks within their schools?
Yeah, I think the first part is just having that conversation. And so a lot of times, especially the rural schools, they don't even have a full-time nurse. So oftentimes that nurse is there, several days a week, and they travel from one school to another school. And so really understanding who that person is and having that conversation. And oftentimes you pique people's interest by going, hey, have you thought about what you would do if a student came into the school nurse's office feeling sick and they had a rash and it looks like it could be, measles? Or have you thought about what you would do if, somebody, especially if you're in an area where there is a high migrant population, because we are seeing some TB outbreaks in those populations. And so, have you wondered what you might do if somebody in a family member tested positive or was active with TB? What would you do with that student? Because once you ask that question, it triggers people to go, no, I haven't thought about that. What would I do? And then you can have that conversation. But another great way to use Zoom would be to have a little forum with your school nurses and just say, hey, we're going to set up a little meeting to have a conversation around infectious diseases and what we might do. You're all invited to attend, and you can have all the school nurses in your school district or in several districts just come on a conversation, and it could just be 30 minutes, over a brief time just to start triggering the conversation, because that's really the start of it.
Yeah. And I think even today, with some of the vaccination, sort of planning, our school district here locally, they have sort of a clinic where they actually do the vaccination. So basically sort of utilizing one of these forums potentially to advertise a vaccination clinic and then further dig into sort of telehealth services and how you use these. I think that's a great tie-in, because then you're using the same technology you'd be using for the telehealth platform to sort of do that. And again, that adds that level of comfort utilizing those systems. So the more you use it, hopefully the more comfortable they become. So if you do need to use it for telehealth, they've actually had experience with it too. So.
Thank you. Another question I had, and you touched on this a little bit within the presentation, but what agency determines the plan or implementation of unvaccinated kids staying out of school during an outbreak?
Yeah, so that's going to be a state health department guidance. And so you should reach out to your local public health department and just ask them, is there statewide guidance around the return to school? So where I live in Virginia, there's an actual PDF document that lists all of the diseases that are reportable, lists their symptoms, lists then what the recommendations for return to school. Most states probably have something like that available. And so contact your local health department. And if they don't have that handy, contact your state health department. Most have a division of infectious disease or infectious disease control. And that's who you would reach out to.
Thanks, Kathy. If there are any questions, as we said earlier, feel free to email Kathy or Brian. Their contact information will be shared along with these slides and resources. And reach out to us at SVHA if you have any questions specific to consents for telehealth with your school-based health center, or just wanting to know more about school-based health centers in general. So let's move on. So we're going to go ahead and we're going to launch our evaluation poll. If you can take a little bit of time just to let us know how this webinar was, we would really appreciate it. And as you're doing that, we're just going to let you know of additional resources and our save the date. So if you enjoyed today's webinar or you attended our last webinar, we have many resources on our School-Based Health Alliance website. So there you see a screenshot as well as a link to our website, www.svh4all.org. Under resources, go to eLibrary and then click on BIPIC and tab, and we have webinars under the series of emergency using telehealth, as well as other resources related to telehealth, vision in schools, and school-based health center resources. So check those out. There's lots of things to learn from our resources. And if you are familiar with School-Based Health Alliance, school-based health centers, or if you're new to school-based health centers, we invite you to join our annual conference, the 2025 National School-Based Health Care Conference. We will be in Washington, D.C. from June 29th to July 1st in 2025. And lastly, we invite you to stay connected with us. We do have a bi-weekly digest that goes out with information on many resources, webinars such as the one from today. Please feel free to follow us on our social medias. We're on Facebook, X, LinkedIn, and Instagram. And as you are wrapping up that evaluation, we thank you for being with us today. Thank you for your time. Thank you for your insightful questions. Thank you to Brian and Kathy for this wonderful content. And thank you all for being with us today. Have a great day.
Thanks, everyone. Have a great day.